Good evening, everyone, and welcome to Managing the Challenges of Clinical Interventions in the Context of Domestic Violence. My name is Lauren Gessock, and I am the Domestic Violence Educator at CESPN. I'd like to begin this evening with an acknowledgement of country. I'm joining you all from Darugland, and we have people joining us from all over Sydney. So I'd like to acknowledge the traditional custodians of the lands from which you all are joining us today, and pay my respects to elders past, present, and emerging. I'll let you know about a new project at the PHN, Project Grow. It's an initiative to support health professionals, support their patients and clients who have intellectual disability. So if you're interested in any training or needs referral support, please contact Project Grow. The QR code on the screen will take you to their website. And then also a little bit about this project. So Domestic and Family Violence Assist is CESPN's new domestic and family violence program. We offer training and CPD events like the one you're joining today, and we also provide referral support and information. So if you come across a client or patient that needs assistance with domestic and family violence, please give us a call or send an email. The QR code will take you to our website as well. So I'm going to stop sharing and I'll ask Ava and Venus to share their screen and we can get started. So I'll also introduce these two amazing human beings. We have Venus Kazantzis and Ava Pauchard here with us this evening. A little bit about them. Venus has been working as a social worker for 40 years. She's worked in a number of child, family and adult counselling positions in community health and in inpatient and community mental health settings. She has worked as a counsellor with the Transcultural Mental Health Service and has provided counselling training with the New South Wales Institute of Psychiatry and the Education Centre Against Violence. She has extensive experience in the provision of trauma-informed, evidence-based counselling and therapy with individuals, couples and families, and also does group work and advocacy. Ava has also been working as a social worker for 40 years. She's worked in local government and non-government agencies, including work with culturally and linguistically diverse communities, and as a couples therapist with Relationships Australia. For the past 30 years, she's worked in both community mental health and domestic violence services. Her strengths are in individual trauma-specific counselling and therapy, as well as developing and facilitating trauma-specific group work programs. She works part-time as a trauma clinician with adult survivors of child sexual abuse and has worked as an educator with TAFE and the University of Western Sydney. So we're very, very lucky to have these women with us this evening to teach us more about domestic and family violence. And just a quick note before I go, we're obviously talking about a very sensitive issue tonight, so please look out for yourselves, take care of yourselves if you need to leave at any point. If you're triggered or not feeling comfortable, please reach out to someone that can support you. All right, without further ado, I'll pass you on to Venus and Ava.
Okay, thank you very much, Lauren. Welcome everyone, and as Lauren also acknowledged country, we'd like to also acknowledge the land we meet on today, and to acknowledge that we do so on Aboriginal land, and we pay our respects to the traditional custodians of this land where we are at the Gadigal people of the Eora Nation, and we pay our respects to Aboriginal people past, present and emerging. Again, welcome, and today, as you saw, or you're here for this topic, we're talking about domestic violence and trauma, which is very complex and unfortunately very prevalent. As Lauren also mentioned, please remain mindful of your own safety during the presentation, and if you need to take a little bit of time for yourselves, please do so. Ava and I are presenting you with quite a large bit of information, and we hope to be, which is comprehensive, and hopefully we may not be able to spend a lot of time on each topic. And as you would be aware, we're providing you with some readings and references and resources, and you'll also receive a copy of this presentation tonight. And you might find it helpful, and I'm sure you will do this anyway, to possibly jot down a few issues that come up that you believe are significant learnings for you as we go. That might be a way to go. And then we'll have questions during the presentation, and Lauren is kind of going to coordinate that for us and read some of the questions out. We'll do our best to respond to all the questions, but time permitting. If we do end up running out of time, certainly we'll be able to respond to your questions in writing, and Lauren will share those responses with you. And yes, we've also got a case study, which we hope you'll find useful. So, okay, just moving along. Yeah, so Ava and I work together. We're working in a specialist New South Wales Health domestic violence counselling service, and we work from a strengths-based model where we provide ongoing risk assessment and safety planning, and we do this in partnership with women. Because relationship and connection are core. You'll hear a bit of repetition throughout this presentation tonight, and I guess we repeat what we want to emphasise that are really crucial points. So apologies in advance if you find things are repeated a few times. We work in partnership, and we work in forming a therapeutic alliance in trauma-specific counselling and therapy with women. We provide domestic violence informed services to women who might be thinking about leaving, who are in a domestic violence relationship, or who've recently separated. And we work with women in relation to the impact of the domestic violence and trauma on their children. We don't see children directly, but we work with mothers to be able to support their children. And we'll talk a little bit more about that. Our services are tailored to each woman and her changing situation, and that's really crucial. We empower women to make their own choices and decisions, and we work from a feminist framework which supports a range of models and interventions. Okay, so our work is very much gender-based. We know that victims of domestic violence are usually female. Most perpetrators of domestic violence are male, who demonstrate gender values, male privilege. They have a strong male belief system. They treat the woman as a servant. They make all the main decisions, and they define men's and women's roles. The perpetrator behaviour is deliberate, abusive, intended to erode her self-confidence, her self-esteem, and her sense of identity. And it's used with the intent of stopping, interrupting the development and the connection between women and their children. It's designed to make invisible what women already do to keep their children safe and in connection with them. Their tactics are aimed at brainwashing her with lies about her to make her believe his lies and disempower her. And men have the capacity to change if they want to, and they actually make parenting choices. So we know men make choices to be abusive. And a good reference is the best practice guidelines for men's behaviour change by Wade and Sutherland, and holding perpetrators accountable and their belief in their capacity to change. Okay, this is a really significant slide. We won't spend a lot of time on some of these stats because you'll have these to be able to refer to, but we just wanted to show this slide because intimate partner homicides in Australia are huge, and it's usually following a history of domestic violence. So there were 79.6% in this period were women killed by a male partner. And also that there are some men killed by a female partner, which is a minority, but often these murders usually happen because women tend to protect themselves or their children. Again, the prevalence in New South Wales, we can see that there's quite a large number of domestic violence related assaults, harassment, threatening behaviour, and being a nuisance. That is something that tends to go with women who are being murdered. And the other important thing to note is that most of the murders occurred, there was an AVO in place, and unfortunately the perpetrators breached these AVOs. And again, just highlighting 75% of victims of murder were women and 84.6% of perpetrators were male.
Okay, hi everyone, I'm Ava, and the other side of this presentation, we're going to be doing a bit of song and dance as we go along. I just wanted to give you a bit of an overview of what we're going to do tonight. So prioritising safety for our clients and ourselves is a big part of the work, and will be, you know, a big part of the work for you when you work in this area. And so we're going to do a bit of a encourage you to review your own work environment, look at how internal safety for clients is important, and how maintaining our own safety in the work is also quite important. We're going to review some of the challenges that are involved in working in this space, go through a range of interventions, which, you know, I'm sure you'll be familiar with, but ones that we've found that are particularly helpful in this work, and then finish up with some resources, references and encouragements to sort of follow up, so that, you know, you can continue to be, you know, well informed. And as Vina said, we can't go into depth tonight, but we're hoping to give you a smorgasbord of things for you to go and follow up on. Okay, so look, we're going to start with a case presentation, and I guess as we're going through the case study, we're encouraging you to avoid making assumptions, start formulating some kind of working hypotheses based on what the information is that we're providing you, ask questions and maintain respectful curiosity, which is what we always bring to the work. Because there's a danger if we assume things. And when we ask questions, we're just always testing what we thought, what we think might be happening. That we ask questions respectfully and with a curious mind, rather than, you know, needing to fill out an assessment or, you know, a safety risk assessment or whatever it may be. So here's our referral. Now, I have a problem because part of the screen is hidden, but I'll read from our written case scenario. So this is a referral from a family doctor. Her name is Jenny. She's a 39-year-old woman from China. Her husband, Dan, is also from China and has been living in Australia. Jenny met him when he returned to China to visit his family. They married in China 7.5 years ago, and then she came to Australia with him. There's been increasing conflict in the relationship. He believes she spends too much time out of the house socialising, and she shouldn't leave the house unless she's with him, taking the girls to school, going to childcare or shopping. The arguments occur when she returns home from being out. She's told her doctor that meeting with her friends is important to her, so she continues to see them and catch up for coffee after she's finished her shopping. Jenny and Dan have 2 daughters, 6 and 4. Jenny has told the doctor that during arguments, he becomes critical of her, calls her names. He tells Jenny she's not good. She's not a good wife or mother. She's stupid. She's crazy. She reported that Dan usually shouts at her, especially when he drinks heavily during the week. And on a few occasions, he's pushed her and punched her in the arm. Jenny was also ashamed to share with her doctor that when she is upset, she sometimes makes scratches in her arm, and that this makes her feel better. Jenny's obese and she suffers from migraines. Now, the doctors referred Jenny to you for stress management strategies and some support groups such as Al-Anon. Now, what we'd like you to do for the next few minutes is just jot down what are the indicators, if you could share in the chat, what are the indicators that Jenny could be experiencing domestic violence? And also, while you're doing that, also, you don't have to note this, but just reflect on what sort of plan would you have for your first session with Jenny. So we'd like you to share with us what you believe are indicators here. The GP hasn't highlighted it as abuse necessarily. So what would indicate to you that, you know, there may be some questions around domestic violence here? So we'll just give you a few minutes. And Lauren will start sharing with us as you start to give us your responses.
Okay, so we have one response, or a couple now. We have, I feel it would be quite rare to receive this amount of detail in a referral prior to their first session. And that's, I think, you know, really good point, especially because you said that it wasn't actually identified as abuse from the GP. Shouts at her, controlling Jenny's time as an indicator. She shouldn't leave the house without her husband. It's another indicator there. Coercive control, attempting to control what she does with her time, and physical abuse. Looking for any visible signs of bruising. So I suppose that's related to planning for the first session. Trying to isolate her from her friends.
Oh, great.
Yeah, that's great.
Yep. And just one more I have here, controlling behaviour from Dan about when and where she goes out, derogatory language and abusive actions.
Yeah, that's great, everyone. Yeah, they are pretty much, we'll go on and just see what we've criticises her for socialising with friends. He controls her, tells, and this is one that we'll come back to. He tells her lies about herself. And this is part of the brainwashing. It's part of the coercive control. Someone mentioned coercive control. And this is a much more subtle one, which you know, a lot of women are experiencing. And if there's no physical abuse, it often just continues and continues. And it's a hard one for police to do much about, unfortunately. He's pushed and punched her, so there is physical here. The fact that he is having his alcohol use, while, you know, it's not the cause, it is also increasing the level of harm and risk, and it would be a high indicator of risk to Jenny and the children. So we also can see that she has been impacted by his abuse because of the self-harming, the obesity, the migraines. These are all impacts, and they're, you know, that's where you can, you know, that's where the GP has, you know, sent her off for, you know, strategies for stress management. And the fact that she feels shame, this is very common, that women who are being abused, and particularly when there is coercive control, will feel enormous amount of shame about the ways, particularly about the ways that they are using to survive, really. And she can, and the other one is that he's undermining her role as a mother. That's a very significant one. And we'll say more about that as we go on. So just think about your plan. And I guess we don't know how Jenny will present until she comes into the room. But the other thing someone mentioned was that it's rare to have this amount of detail. And again, perhaps we need to think about the referrals that are coming to us and what we want from those referrals as well. But we'll say more about that again. We don't know with Jenny whether she's going to be coming in quiet and quite not being, you know, feeling, you know, she doesn't quite know where to start, whether you're going to need to ask a lot of questions. Jenny, in fact, has walked into your session and she has a lot to tell you, as you will see. And so she will need to be, you know, telling you all about what she's experiencing, or a lot of what she's experiencing. And I think Venus is going to take us through that.
Okay. So thank you, Arthur. So during your first session, Jenny states that Dan tells their daughters in front of them that she's lazy and that she doesn't love them. Jenny has a part-time job and she also volunteers at the local church. Dan believes she should spend more time at home, and in the sorry, a little bit's covered there. And in the past fortnight during an argument, Dan attempted to choke her and she managed to free herself. Their two daughters witnessed this, unfortunately, and they were screaming. When the neighbours heard the children screaming and Dan shouting, the neighbours phoned the police. The police attended and applied for an AVO. Dan has moved out and is staying with his brother, and there are conditions there in the AVO for Dan to not contact his family or go near their home. Jenny is currently staying in the house and they were renting the house and the lease is in his name. Jenny has been receiving texts from her husband's brother telling her the right thing to do is to withdraw the AVO and allow Dan back into the house. Jenny's brother-in-law reminds Jenny that Dan is your husband and tells her that the family blame her for this situation as she should be a better wife. They believe that it is Jenny's fault that Dan lost his temper with her. A few of her friends are also advising Jenny that it will be difficult for her to survive as a single mother and adequately parent their two children without a husband. Okay, in this initial session, Jenny tells you she's feeling confused. She wonders about whether she should go to court to stop the AVO, and she shares with you that she feels it may be best to ask Dan to return home because of what her friends and her brother-in-law are telling her. She shares with you that she plans to try harder and not talk to him when he is upset. She confides that she needs to be a better wife and mother. She believes that she should go to counselling with her husband. Jenny tells you that her husband has never really spent much time with their daughters. He's disappointed that she did not give him a son. Her youngest daughter had started to wet the bed and both daughters are having regular nightmares, waking up during the night and crying. They also have become very clingy to her and not wanting Jenny to be alone with Dan. The girls want Jenny to lie in bed with them until they fall asleep, and her 6-year-old daughter has told Jenny that she's frightened of Daddy. Jenny discloses that she worries about her daughters because when she was around their age, she experienced abuse from her uncle and she has never been able to forget this pain. Okay, when asked about family and community supports, Jenny responds that she does not want her community, to know of their troubles and that she is not close with her mother, who is in China. Yep, thank you. And Jenny describes her mum as always being very critical of her. She disclosed that her mother has said to her that she's a bad daughter, and Jenny believes herself to be a bad daughter. Jenny said she was feeling very sad and found it hard to cope. Jenny reports that during the first 3 months following the birth of her younger daughter, her mother came to be with her in Australia, but that her mother criticised everything she did. And during the visits, Jenny tells you that she was crying all the time and sometimes had thoughts about suicide.
So I guess what we're wanting you to think about is what, as you're listening to this long story, think of it. And, you know, she has obviously kept talking and given you a lot of information. And in that, we'd like you to pick out what she's identified already as Dan's abusive behaviours. She may not have called them that, but you may have recognised this as, you know, abusive behaviours that hadn't yet been disclosed. There's also been an incident since the referral that, you know, she either didn't tell the GP about or has happened since the referral, which has brought about the AVO. So as well as thinking about his behaviours, also think about how those behaviours have impacted on Jenny and the daughters, just from the information she provides. Then also, if you can turn your mind to thinking about how she's actually been resisting his violence and abuse, and ways you might start to join with her or partner with her and focus on her strengths, because, you know, she's certainly presenting you her story of someone who doesn't feel that she's terribly strong at all. but she does have strengths there buried in this narrative. So look, we'll give you a few minutes, and we know that, if that's not enough to be terribly comprehensive, but I just, if you can, I guess, share anything of, those things that has stayed with you as we were reading it. And, you might want to just look over it. You can't look over it, sorry. I'm just not used to all this technology. If I was seeing you face to face, you'd have it in front of you. So you can't read it. So whatever you remember. Sorry about that. Yeah, so I guess, there's one thing we didn't say. You could perhaps have been jotting down, as if Jenny was talking to you, some of these things. But Lauren, how are we going? Is anybody ventured out with something?
Not just yet.
No, that doesn't surprise me.
I will keep you posted.
Okay. Okay.
Okay, we have a comment. I personally find it more challenging to work with current DV victims, as I feel strings pull to the rescuer role, whereas I find it more comfortable to work with a perpetrator. So as I'm considering these questions, I'm struggling to identify suggestions so I can clearly see the issues. Wow, that's really interesting.
It's very interesting. So that's someone who works with perpetrators, if I understood that?
I don't know necessarily, but I think there's more comfort working with perpetrators.
Okay.
The daughter's attachment styles, regression and needing safety with the mother a lot more. So looking, I guess, at the impacts on the children. One impact is self-blame. Jenny thinks she needs to be a better wife and mother, and that the abuse is her fault.
Mm-hmm. Yeah.
And then we have some strengths here. She's maintained a part-time job. She's still seeing and talking with friends and reaching out to them for support. Absolutely.
Yeah. Thanks, everyone. So look, this is something we prepared earlier. So Dan's abusive behaviours and the impact on the daughters, controlling her by monitoring her, wanting to control her movement, stop her from socialising. So it's good to actually list the behaviours. He's blaming her, telling her it's her fault. He's arguing with her, shouting, criticising, brainwashing again. What we said earlier, telling her lies about herself to erode her self-esteem, self-confidence and identity. Women will often say, I don't know who I am anymore. And physical abuse, the choking, the attempted strangulation, the hitting and the punching. The choking is something particularly, to take notice of, because it is, again, an indicator that this woman could go on and be murdered. It is statistically, it's quite high that women who have experienced strangulation from intimate partners could well be murdered, as women who experience coercive control. He's abused her physically and assaulted her while the children were present. And they are continuing to be impacted by the behaviours because there's bedwetting and nightmares. And this is something that's fairly common, that even after separation, children are still exhibiting the impacts of the abuse. Now, her strengths, or how she's been resisting his violence, as you've said, continues to catch up with friends. She volunteers at the church. She's doing part-time paid work, talking to a doctor, and she actually did describe his behaviours and talked about his alcohol use. And she's able to discuss with you the daughter's bedwetting and nightmares. So she's actually, bringing things to the table. Now, ways that you might partner with her, and in terms of joining with her around her strengths, is to really acknowledge and dig for those, because she's not seeing them. So we, particularly in first session, to mind for these strengths is important because it kind of sets the foundations for your future relationship, and she'll walk out feeling comfortable that someone has heard her, we're starting to hear her. So you look at her courage, that she's actually, come to seek assistance. That's a courageous act. And you also help her to understand his abusive behaviours, because although we talk about them, women don't always recognise it as abuse. They will say, oh, when I do this, then he gets stressed and then, he'll push and shove me around, but doesn't actually identify it. And this is a great part of the work, is to actually help them to understand this. And this can be quite a long process. And the fact that, she's holding on to the blame means that we've got a lot of work to do there in terms of a lot of psychoeducation, that he is the only one responsible for his behaviours, his abusive behaviours. And again, we help her to find a voice and understand what's going on, find her own voice rather than have his voice in her head all the time. He's using power and control to abuse her, so a whole range of abuse. And so he wants her to believe that he wants her to believe the story he has about her. And that's going to be the way that, and this is all the things that we can keep talking about in the counselling room. Not, this is, beyond the first session. It's, first session, you wouldn't get to all of this. So validating her experience and what she's experiencing and what the children are experiencing, unpacking the vulnerabilities. She has childhood trauma, so at some point you will need to get to that, because what he is doing is triggering some of that stuff, and he's actually taking advantage of that and using it for his own ends. And of course, an ongoing thing within the feminist framework is to assess safety, both internal and external, and we'll say more about that soon. Acknowledge and validate her strength ongoingly all the time and the ways she resists, and also support her to explore her concerns, identify her needs, and be able to advocate with her. And as I say, this is the starting work that you'll be doing over the first few sessions. But then, you need to build on it as you go. So as moving right along into prioritising safety for the client and ourselves, we need to create, as you've seen with that case study, we need to have a safe, trauma-informed space for each woman. That's why we started out saying we can't make assumptions. We need to find out for each woman what is safe for her. Think about how clients with trauma may experience the space that you work in, and notice your own experience when you're walking into your space. The internal safety for clients, we can't do much unless they feel safe in the counselling room. So the relationship that you develop is really important from the get-go. So the way you present is really important in session one. And those of you that are working in the field, you know that. So developing trust starts from when she walks into your space. And we start to develop this partnership and collaboration with women from the minute that they come into our counselling room. The internal safety is helping them, and if they don't trust us, we can't do this, to help them to recognise and manage the triggers. So with Jenny, him being critical of her is abuse in itself, but it's a double whammy because this is what she has experienced from her own mother. And she became suicidal when her mother was here. And so there's concern about her own internal safety here, which we need to work with very gently, because unless she's internally safe, she's not going to be able to be terribly effective with the external dangers and risks to safety that he's bringing to her. Safety for ourselves is important. When I said looking at the referrals we get, we've actually keep developing our referral form so that, sorry, I keep disappearing out of the screen, I realise. We keep developing our referral form to make sure that we're getting all the information we need at the point of referral. And that's important so that we actually make sure that it's a referral that's appropriate to our service. And I guess, you know, we all need to do that wherever we're working. So that goes to very much looking at our work environment and who refers to us and how they refer, as well as the physical environment of, you know, how safe the building is, how comfortable we feel. Always being mindful of our own trauma. Some of the stories we hear are very distressing and needing to sort of break up our caseload. I mean, you know, this is stuff you're probably all aware of. And looking at ways of preventing burnout. Again, I'll look at that a bit further. And we've got a reading that we'd like you to go away and do, because it's quite significant, I think, in terms of not looking at it individually, but looking at it more as a social issue as to what happens to workers in this space. Because self-care strategies only work so far. We need to also look at ways that we can be able to, I guess, as a community of health workers, of counsellors, be able to connect with one another. So, as we said, safety is at the centre of all trauma-specific and domestic violence-informed counselling. It's a combination of the woman's internal safety as well as what's happening outside. So the counsellor in the space must feel safe so that she can trust us with her story. You're not going to open up unless you feel that. If you're feeling at all judged, although, you know, people are saying we got a lot in the referral, she may have given that to her GP over several visits, whereas when she comes into the room with you, hopefully she'll feel secure to you know, by just the space, and that you've created a secure environment for her that validates her experience, that you show that you're open to advocating with her to support her, and that this is going to be a respectful relationship between the two of you, and you are going to be in partnership on her journey to recovery. Now, our best outcomes for safety and wellbeing of women and children doesn't just depend on what happens in the counselling room. It depends on collaboration, communication, sharing information, and networking with other services, other providers, so that we're not working in silos. Because we will need to refer her to different services, and we'll, you know, look at that later as well, be it housing, be it legal, be it the police, be it a mental health service, whatever it may be. And we need to all be on the same page so that she doesn't feel she's entering different worlds for different things. It needs to be a coordinated, integrated approach. And we need to see if we can somehow orchestrate some timely responses and interventions to assist her if her decision is to leave the relationship, or if it's not to leave, to keep her safe where she is. Okay, so now I'm going to just ask you to reflect on where you work. What's your space like? When you walk into your counselling space, what does it feel like? What creates this space for you? What's on the walls? What are the chairs like? The temperature in the room? What are you aware of inside and outside of the room? What sounds? Any aromas? Do you burn candles? Do you have a window? Is it cozy, spacious? Are you comfortable working there? Are you comfortable in the space? And then once you've sort of had a bit of few minutes, I'm sorry, this is going at quite a pace, to see how you feel, how do you think a traumatized client, such as Jenny, might experience the space? How will she respond if you do have candles? How will that help her? If you have a window, is that good for her, or is that not so good for her? You won't know this, and you may not ask this in the first session. It all depends on, you know, what happens in the room. Some clients will say, "Oh, can we have the blinds closed, please?" Then you know. But it's just always being aware of how this space is for this particular woman. Then think about who your colleagues are, how often you connect with them. You know, if you meet, do you meet at a local cafe or alternate between workspaces? What's the demographics of the area you work in? Have you got any, you know, interesting places to walk in? What are the local services in the area? Have you got time to visit them? What community activities and meeting places are where you work? Because apart from you being able to know what services are available, if your client is having, you know, has come, you know, feeling quite distressed, and you've been able to sort of have, or you've had a heavy session, you might be able to say to her, "Oh, look, there's a nice park," you know, if that's a place she would, you know, that might help her further. So looking for ways you can connect people to the environment in a helpful way. Now, I'm just wanting to help you to think more about your own practice, and as we said earlier, think about your referral sources. Where are they coming from, and how much information are they giving you? Is it enough information? And what are your special interest areas, and what are your strengths? Very important to identify that, because if we're not used to talking about our own strengths, it's going to be hard to remember to hone in on the strengths of our clients. Our areas of expertise. And again, as we're going through this, think about areas you may want to develop further, any professional challenges you think you will, you need to address for yourself. And think about what networks you have and what networks you may need to develop, supports, both formal and informal. What are your supervision arrangements? All this is important, I guess, in the space. And sometimes we think we don't have time, but there are areas we must make time for, because just as connection's important for our clients, it's very important for us, given the work we do. And I guess all of you, are connected to this learning space, which is really important. So think about how you do risk assessment and safety planning with clients, and think about your vulnerabilities and the ways you need to be aware of, so that you are engaged in burnout prevention. Now, here's the article I would like you all to go and read. We're sending this in the package. Richardson and Reynolds, who really talk about social justice. And I guess as social workers, as well as a framework of feminist framework, we've certainly got a lens of social justice. And the work we do is made up of women's stories, but also out of those stories, we get a lot of trends and themes that and then, we hear about in the media, and we cringe sometimes when, some of the suggestions are made about how we are going to get rid of domestic violence. And, maybe it's about bottle shops and how long they are kept open. That might help the situation. Maybe, there needs to be more AVOs. And we know that that's a lot of bunkum, because it really just comes down to power and control. And we're very often frustrated in the work, and that's where our burnout comes from. Our burnout comes more from the frustration of the work and dealing with systems that really don't get it, that they are actually preventing women and interfering with their safety rather than being at all helpful. And we're caught up with that with women because we hear about what happens to them. And that's what we mean about external safety. It's not about just safety, being safe from the perpetrator. It's very often, unfortunately, being safe from police, being safe from the legal system, family law. There are a lot of systems out there that really stuff women up and continue to do so. And that is where we get our burnout. It's not their stories, it's the injustice of a lot of our systems and the way our society is working, and really oppressing women, and particularly women who are from marginalised backgrounds as well.
Just to add a little point there, thank you, Ava. Just for us, we're fortunate enough to work in a team, in a service where we're all working with the same issues. And one of the ways we kind of look at the prevention of our burnout is we share our frustrations around systemic abuse and the inconsistencies with services, and we share that. And how we gather our strength is to really reinforce to each of us and as a group that we are chipping away at advocating and working with other services. And that's an important way we, as a team, try and address the systemic frustration and challenge.
Yeah, because a lot of the perpetrators actively use systems against women. That's part of their tactics. But sometimes the perpetrator doesn't need to be involved. Your systems will do it anyway, without any help from him. And that's the frustrating part of it. So look, please go and read that article. It's written from a social action point of view, and it's community workers. But if we keep that sort of lens in mind, we are going to be a bit more effective in being able to help women to find their voices and really help them to build their strengths and I guess resilience in this world, basically, because we're working with their bodies and their minds, yes, because that's where their trauma sits, but we've also always, and this is the domestic violence informed part of it, is that we've always got to be mindful of the social world that they move in. Yeah. So look, risk assessment and safety planning. For some women, it is safer to stay than leave. And we support them because for some, they may not be able to leave until the kids are adults because of the particular setup in the family, that at least she knows what he's up to. If she separates and the kids then, get access to him, she won't be able to monitor what goes on. And a lot of women stay for a long time until their kids are a certain age. And if for women who decide to leave, it's not a linear process, and we're usually supporting women as they practice to leave. So that may be that, they have a bag with all the essentials, all the documents and everything that's needed if she suddenly needs to escape at family or at friend's place. Or she might, at different times when things are really bad, she may go with the children to a motel and he will get used to this pattern that she goes and she comes back and she goes and she comes back, and one day she won't come back. So there are different ways that women practice. The most important thing is that we are non-judgmental, that we respect, we understand, and we honour her choices, because she is the one who knows best what's safe and what isn't. So ask her about what she knows about the perpetrator. She knows better than anyone what he's capable of. His tactics will change and they'll escalate. He's always wanting to maintain control. So as he notices that she's becoming stronger as she's practicing to leave, then he will start to increase his tactics. He will escalate. So this is why separation is a period of extremely high risk to women and children. A lot of women are murdered, as we know, at this time. And so safety planning must be ongoing, and it continues for a long time, even post-separation. This will always be a feature of your sessions, and it always is a feature of our sessions, no matter what stage they're at, no matter how long they have been separated. Again, be aware that what we've got is the internal safety and the external safety. Janina Fisher, she's someone else that, you know, we've been to conferences, read her books, and really encourage you to do the same. She has a really good way to look at women who are feeling suicidal, and how you work with women who are engaging in self-harm and risk behaviours. Recognise when women are in a trauma state and help them to, you know, ground and you know, really get through that if they, you know, that's what they come with to one of the sessions. And they will, you know, go in and out of this. And for us to be able to, as we know them and develop a relationship, we're able to help them with that. And while they're dealing with that, of course, you've got the external stuff happening. You've got the perpetrator, you know, doing all sorts of amazing tactics. And of course, you've got the systems backing him up, be it family, sometimes it's her own family. It could be church, could be culture. Sometimes these are supportive and sometimes they're not. And it's about sort of teasing out what that external world looks like for her, and how you can help her to find safety. So when we do a risk assessment, we've got to look at three components. Her perception, that's why we're talking about partnership with women. It has to be in conjunction with her. Her fears, you know, her history. What does she believe he could be capable of doing? You know, it's not just what he's done, but what might he be capable of doing? She's the one that knows that. Also, we need to be mindful that sometimes women will minimise his actions, because that is also a coping strategy. I just need to get through this day, so I'm not going to take much notice of the fact that he's nearly strangled me, you know. So our professional view, based on our knowledge of the client, and it's always got to be based on because our professional view, without that relationship and getting to know her and what she's dealing with, our professional view is not going to be worth very much. We've got some tools that we use, the risk assessment tools, and again, that's part of the package that we're providing you. Have a look at those if you're not familiar with them. The more you use them, the more you won't need to refer to them, because you just know a lot of the stuff. Now, okay. I've passed you over to Venus.
Thank you. Thank you, Anna. So just moving along, it's important to, when we're in partnership with a woman, to look at the tactics he also uses from afar, the social systems and the legal systems. Also what he says and does to their children, as you saw in the case with Jenny. And I also look at maternal alienation, where men, abusive men, as Jenny's husband was doing, undermines women when they have, particularly when they put her down and they're very critical and they undermine her parenting and her relationship with the children. That's a huge tactic, where the men want to destroy the relationship that his partner or ex-partner has with their children. and continually undermines her. As with Jenny, he was putting her down. Often what men will also do is, if they have access to children as part of the family law order, they will often tell the children lies about their mother, that their mother said she doesn't love them. So what we find is that that will impact on the children, and when they go back to their mums, and we'll talk a little bit more about that, they may be distressed, they may be defiant. And part of our work with women is to help women understand what he does away from them when he has access to the children. It's important to ask her about him and his behaviours, as Ava previously said, to help her understand and help us understand what he is capable of doing, so we can better support her resistance to the abuse and her safety. And it's important to note any changes with the woman in the pattern of escalation of his tactics. Coercive control, we've mentioned that before, and we saw that in the case study with Jenny. And it's around him planting seeds of self-doubt to erode her self-esteem, self-confidence and identity. And that's huge, because if this is his script, he continues to tell her this every day, numerous times a day. So it can be, she would absorb that. And that is also one of the barriers that we'll talk about later. The gaslighting. And this sort of abuse is subtle, it's understated and it's undetected, because it's not physical abuse. We often get women, as I'm sure you do, who say, I'm not sure if this is domestic violence because it doesn't actually hit me. And I think this is minimised by other professionals, like, for example, the GP, the doctor who referred Jenny to you. He didn't name it. He didn't identify it as domestic violence. And it's great he was able to refer her for support around obesity, but he didn't pick up. So the brainwashing, as we've said, is really powerful, and it's that pattern of controlling behaviours. And we've got a study included in your package, which is about intimate partner femicide. And it's important to note that in that study, all victims included in that study experienced coercive control during their relationship, and most were in the process of attempting to regain some level of autonomy at the time of their deaths. And that's tragic. It wasn't the physical abuse or the threats of that, it was the coercive control. And you will get this in your package. It's very powerful.
Yeah, it's a qualitative study. So they've interviewed family of the victims, and they reviewed, and every woman was in the process of leaving or had left. And the other really telling thing about the study is that neither the loved ones nor the victim actually identified it as abuse. They were talking about things that he did, but didn't identify it as abuse. So we have a significant role in naming it and helping women to actually see it for what it is.
I'll just, while we're there on coercive control, just to show you, one of the things that we'll talk about also is about our connection and our networking. That we have a domestic violence committee that we are members of, and we developed a coercive control brochure, which, yeah, I don't know if you can see it.
Won't see terribly well.
No, anyway, it's a little Z card, and it opens up, and it's quite powerful in that it's quite an important tool to use with women, but also with our community in educating other services about the damage of coercive control, and that it can be fatal. So we've got this, and it was developed by our committee, but it's been picked up by a service in Canada, Quebec, where they're asking to have a look at it. So if you want
to translate it in French,
yes,
because that's where they're using it, would like to use it. And again, the power of actually connecting. I mean, we were able to produce this because we connected with other services, and then there's an international service wanting to connect with us here in Australia.
Can I just chime in just for a second? I actually have a lot of those in hard copy in a number of different languages. So if anyone, I just picked them up the other week actually. So if anyone would like some copies, please contact me or let me know in the chat, and I'll take a note and I can get them to you.
Thanks for that. Yeah, that's really valuable.
Thank you.
So,
Okay.
separation.
Yes, so separation, as we've said, is his control and abuse, unfortunately, does not usually end with separation. It's a time of heightened risk for intimate partner femicide, homicide, with men murdering their wives, ex-wives, partners, and sometimes children, most commonly within the first year of separation. So stepping out of the violent partner's control often will lead to an escalation of violence because he will need to up his tactics. Before a woman leaves, he is very attuned to any changes in her demeanour. He will start countering her efforts to resist. Any strength he sees, he will counter with other abuse tactics, increasing his threats, interrogating and having age-inappropriate conversations with children, getting children often to spy on their mothers, monitoring and preventing their alone time with their mum, and escape planning is really important. Okay, so it's really important, as Ava mentioned previously, and I guess it's so important that to note that leaving is not a linear process. Talk with her about a safety plan. Consider the risks with her so she can decide who to tell, not to tell about her plan to leave. Her partner, partner's friends, family, her family, friends, and the children. And it's important for her to plan and prepare over some time. She might start packing, removing some important documents, valuable items from the house to facilitate a quick and safe exit and not to be noticed by him if things leave slowly. Leaving a relationship, as we've said, it's not something that will keep women and their children safe. And as Ava also mentioned, choosing to stay may be the safest option.
And, we work with a lot of women who have stayed in the relationship, and just help them, partner them with them in that,
to keep
in that entrapped situation.
Yeah. And that's an important word, the entrapment, because that's what ends up happening. This is a post-separation wheel. We won't spend too much time on it, but it covers a lot of what we just talked about.
Also in your resources,
it is,
so you can see it better.
Yeah, it's both in the presentation you'll receive and also in the resources. So you'll see that. So it's about the types of abuse, and we've kind of mentioned some of it. The maternal alienation, using the children, sexual violence will increase, harassment and intimidation will increase, undermining her ability to parent, as we said, and discrediting her as a mother, disrupting her relationship with her children, and also the increase in abuse. Okay, so we'll just spend a couple of moments if you can have a little bit of a think about what some of the barriers to leaving are, and Lauren will kindly read out some of the barriers that you jot down. So we'll just give you a minute or so just to have a little bit of a think.
Just whatever comes to you. You may even want to think about Jenny's situation. At the moment, they are separated, but they may not stay separated, and what would be some of her barriers.
While we're waiting for people to respond to that, I just want to mention a couple of comments that have come earlier. So we had a comment earlier when you were talking about creating that good relationship in that first session, talking about violence as a choice, whether you're talking to the victim or the perpetrator. And that can be a great way to remove that self-blame. Also, in terms of creating a safe environment, one person mentioned that they're allergic to soy candles, which is something that's very commonly used. So obviously being aware, not necessarily just of the trauma, but also that, people might have other aversions to things. One, I believe, she's a psychologist, said that she uses a therapy dog, which is a great way, which I just think is wonderful.
Just check that people aren't afraid of dogs.
but she did mention checking beforehand.
Yeah, of course.
Exactly. All right, so we do have our first comment about barriers to leaving. So cultural upbringing, being a parent and believing that staying will keep the family together. A financial dependency on the partner.
Big one.
Family and cultural expectations, self-esteem. Again, about financial barriers, availability and access to housing.
Yes. Okay.
They're all great, thank you. And
so
we'll get to some of those barriers. We also, thank you, Lauren, and
this
thank
is
you
the
everyone.
biggest barrier to leaving.
Yeah, unfortunately, yeah. Ava and I started to think about some slides back in January for this presentation, and we looked at the stats. This particular one, it's a Facebook page, Destroy the Joint, Counting Dead Women. In January, there were 4 women who'd been killed in Australia, and as you can see, last year there were 43, unfortunately. And then we looked up the current one, and it was 12 in March. However, since then, unfortunately, there was another woman,
a young woman, Friday night,
yeah, in Newcastle. Yeah.
And that was, she was 21, the perpetrator 22. He had breached the AVO, a small baby who didn't get hurt, but was present. And, you know, that sort of is tragic, and it looks at, you know, when I talked earlier about themes and trends, this keeps happening in our society, and it comes, and this is why we really look at the gendered approach and looking at the feminist framework, because while, you know, women are oppressed, and we, you know, okay, we've come a long way, but we are still oppressed. And if you're coming from any of the marginalized communities, then you are more at risk, because if you don't have equality, then the society is not supporting you. And this is where our frustration with systems comes about as workers, because the systems are really not there for women. And we see it time and time again.
Okay, just looking at some of the barriers, you guys did really well, and you covered quite a few. So again, just going through quickly, the perpetrator tactics can escalate as she's leaving, and the fear of murder, stalking based on his actions and threats.
You mentioned economic resources, that's a big one.
Yeah. The slow responses from external services, you mentioned that in terms of financial and housing. Disbelief by a lot of the systems and punitive responses. Family law is a huge one.
Often work against women.
Yeah, yeah. And visa-related barriers, where she might be being sponsored. It might be a partner visa, and he tells her lies that if she gets help or leaves him, she'll be deported. Often women don't have that for the correct information. Cultural,
as you mentioned. Yeah.
As you mentioned.
Okay, so look, I'm going to speed through this because it's really looking at the prevalence and what we, you know, said earlier. There are groups that are particularly vulnerable. Some women are more vulnerable than others, but there are multiple forms of abuse, and they co-occur, and women are re-victimized. You know, with Jenny, she was, it sounds pretty much, if we unpack her story, she was probably abused as a child, and so she's now re-victimized because she has vulnerabilities that perpetrators will actually pick on and use to their advantage. So the groups that, you know, we're all aware of, Aboriginal and Torres Strait Islander women, women with a disability, women from cold backgrounds. So, you know, Jenny is someone who was reluctant to go to her community because she was feeling an incredible amount of shame and, you know, a lot of cultural beliefs, as someone earlier mentioned, that always comes into the mix as well. And, you know, lack of knowledge about, you know, the laws and, you know, how things are different to where they've come from. Women who are pregnant and younger women, as we've seen with our recent murder victim. She was a young woman with a baby, and, you know, that's a combination. She's only, you know, I don't know how old the baby was, but he probably escalated during pregnancy, and also, you know, ended up quite tragically. And older women is another group that are particularly vulnerable. Women with mental health issues, they've usually got a very long history of victimisation, and it's a strong factor for developing a lifetime of mental health issues. We often are working with women who are in the mental health system, and 90% of mental health clients have been exposed to multiple experiences of trauma going back to childhood, and very often are in abusive relationships. And they're three times more likely to have a diagnosis of depression or PTSD. And the longer the women are away from the abuse, surprise, surprise, there's a decline in their depression. And the longer the duration of the DV, the worse are the health outcomes. There's no surprises there. Again, there's a link, as we also saw with our case study, between DV and substance abuse. In our case study, Jenny wasn't the one who had the substance dependency, but many of the women we see do use drug and alcohols as a way to numb, escape, block out their feelings, and just help them to get through the day, basically. And you'll find that, you know, these women will use, they are still mindful of their children, so they use when they know that it won't impact the children. Not all women, it all depends on their particular circumstances. Certainly there's an increase in their victimisation when there is drug use, so he will use that to control her. I had a client who he would provide her with drugs. This was his way of controlling her, of abusing her sexually. And for a long time, she was a woman who was very long history in mental health, who didn't see it as abuse. It took a long time working with her to actually help her to understand the abuse. Now, men like Dan in our case study are perpetrators of domestic violence. They're not perpetrators because of their addiction. I think most of us know that. So hence when they're talking about the closing times of pubs or bottle shops, it's almost laughable, because yes, if they're already perpetrators, they will present a greater risk. And as we saw again with the murder on Friday night, my understanding was that he was under the influence of drugs and alcohol, but it means he presents a higher risk. It doesn't mean that, then get rid of the alcohol and then we'll have sorted out the domestic violence.
Okay, as Ava has mentioned, in terms of prevalence and vulnerabilities, co-occurrence and re-victimisation are very common. So violence, abuse and neglect, they're rarely experienced as a single incident. So many women experience multiple forms of violence, abuse and neglect, and they either co-occur or they occur at different stages across their lives. And you'll see it in this slide from Costello and Backhouse. It's a New South Wales health project that they were involved with. So the reference is there.
Yeah, and if you go to that, you'll find a lot of other interesting stats and information. So that's another one we'd recommend to you.
Definitely. Okay, and that this again shows how the violence is it's integrated violence, abuse and neglect. So you can have someone experience domestic violence, and then they experience sexual assault in the domestic violence, and their children are exposed and that they are traumatized, and it can lead to problematic and harmful sexual behaviours in some children and young people. Then you've got childhood sexual abuse and neglect again. Okay, and the health outcomes of violence against women, as we've talked about before, unfortunately there are fatal outcomes of homicide, suicide, maternal and infant mortality. Fortunately, the young baby, I think it was a 12-month-old baby.
They found blood on the child, but the child was unharmed.
Thank God for that. But I think that just to be mindful, and you would probably know that men who threaten suicide often don't suicide, and it's a way to keep the woman.
It's another tactic.
Another tactic, exactly. Physical health impacts, we can see those there. The negative health, other behaviours including overeating, and Jenny certainly was experiencing obesity, chronic conditions, as you can see, there's a whole lot there, and mental health that we've mentioned as an impact, and substance abuse.
So I guess when, where we know that the women coming to us are experiencing domestic violence, but when they present at other places like their general practitioner, it's not always easily identifiable. Yeah.
Okay, and just again, if you just take a moment to have a think about what are some of the common myths that we hear about domestic violence. So if you just want to jot down a few for Lauren to kind of read out for us.
We don't have any so far, but
No, so far.
none so far. Okay, we do have one. This is a good one. Okay, they're coming in. It only happens in poorer families.
Oh yes, that's a good one. I don't think we have that one, but that's a good one.
Very good one.
Also, if it was really bad, she would leave.
Oh yes. We don't have that one. We've got a bit of a version of that one, but that's an excellent one.
Both of those.
Yeah, very excellent. Look, if we had more time, we'd linger and chat more, but we don't. So look, this is also something we prepared earlier. The question, why doesn't she leave? What's stopping her? Similarly, if it was really that bad, she'd leave, surely, wouldn't she? And all problems would be solved if she'd go. And there's that lack of understanding that, in fact, if she goes, it might be more dangerous. So there's some of them for you to have a look at. The apprehended violence orders, they don't protect all women. And, we see over and over again, not just with the poor woman on Friday, that, it's not a guarantee of protection. And sometimes it makes life more dangerous. This is why knowing the perpetrator is so important. And police are a bit gung-ho sometimes. I mean, it's good that now they have the power to actually apply for the AVO. Sometimes they should be applying and they don't, and other times they really shouldn't be applying because it's too dangerous, and they just still need so much more training. People still can't get domestic violence unless there's some physical bruises or a hospital admission as a result. And the idea that, if his mental illness, his addictions and his problems with anger were sorted, then all would be well. DV isn't a cultural issue, we all know. And the big myth that women are the ones that are responsible for keeping their children safe. The responsibility always lies with the perpetrator if children are unsafe. It's not about stress. Domestic violence is a choice. And it's about control. It's about power. It's not about stress. Yes, he may have been abused as a child, but that still is not, he still can choose. He knows what abuse feels like, so he can choose. And he can also choose to get counselling. A lot of them, yes, they are needing assistance, but they also choose not to go for assistance. And the other one is the assumption that you contact the police and everything will be solved. The police often don't know what to do with many of our clients that we see. And particularly when there's coercive control. Even talk about, the legislation which has seemed to have been successful in Scotland. We really need to look at how the legislation is interpreted and put into practice.
For coercive control.
Yeah, for coercive control. Yeah. Okay, so the challenges of DV-informed counselling. As we said earlier, women are not necessarily acknowledging or labelling his behaviours as abusive. And so they may not even present for DV counselling. So this is why we really need to be on the lookout for the signs and the behaviours and some of the impact. So when women present with, drug addictions or mental health issues or various physical symptoms, always good to have the question in the back of our minds, could this be an impact of abuse? So there are so many risks that women face if they are contemplating leaving. And there are so many challenges on the way, and it's our role to help them to negotiate that. And that is the tricky part, because we're also facing the challenges with her. It doesn't have as great implication for our lives as it does for her, but we are experiencing that, and we're trying to help her go through that minefield. Risks for women and children, again, we keep repeating this, but it's important that leaving and post-separation is the most risky time. When the woman feels empowered and independent, that's when his tactics change and escalate. Rosie Batty's situation, I always remember, her talking about, how, he was someone who was with the mental health system. Nobody saw what was, the tragedy that was about to unfold, but she had become more independent, more empowered, and he, of course, needed to maintain control in some way, and we know what happened. So this is the need for ongoing risk assessment, safety planning, particularly as women get stronger, as they become more independent. It's really much more important than when they arrive feeling ashamed at their first session. And again, it's not a linear process. They will have many goes at it and be frustrated at many turns. And it's not because they lose courage, it's because services are not supporting them. So if we're going to work, we really need to identify the specific challenges for a particular woman and her children. We can't just have a checklist. We need to really, this is why the relationship is important. We really need to get to know the situation with children, and know that whatever happens outside is going to be brought back into the counselling space and impact whatever work you're doing. Risks to her and the family increase. This is part of the challenge. Leaving changes everything, and change is hard. We all know whatever change is going on in our own lives, which may not involve violence and abuse, is so hard. When I had to change a mobile phone, because not by choice, it was hard. And so if as human beings we struggle with change, and these are women and children who often are leaving behind, their home where, they've got all their favourite things, and that some have had to leave pets behind or give pets away or change schools, or a whole range of losses. And it's something that our society doesn't always recognise, that this is a grieving process for mum and children. So supporting her internal safety so she can manage the external risks to safety is so important. So really being with her and helping her to manage her response to change, so that she can soldier on, basically. And as we've said before, external safety unfortunately depends upon other services supporting women to leave in a timely and respectful manner. So the more we can connect with other services and have conversations, and at least have people planted in services who get it, is so important. So it is a partnership relationship that we enter into with women. It's trauma-specific, domestic violence informed. You can't have one without the other if we're going to help her in any way. So relationship and connection between us and the woman, which is individually tailored to her. We need time. It doesn't develop after the first session. It develops over time if she's going to trust in us and to feel safe with us. So safety and stabilisation, again, Trauma and Recovery by Judith Herman. This is our Bible in domestic violence. Early work, but really such important work. If you haven't read it, do read it. And she goes through all the stages for women who are recovering from violence and abuse. Safety and stabilisation must happen first. Otherwise, there won't be connection to others, and connection is what is going to help women to recover, to heal. We work in partnership, collaboration with women. So that means we believe them, we acknowledge them, we normalise what's going on for them, that, you know, they're cutting into their arm. Well, yeah, well, you know, it's either that or drinking Scotch whiskey every night, a bottle of it. You know, that's her safe way of releasing some of that stress so she can get on the next day and do what has to be done. So validate her experience and the impacts. So in all of this, it's so important that we reflect on our own practice, what we're doing, being self-aware. We need to be regulated. We need to make sure we're responding to what we hear is happening for her and not reacting. So hard to do, but sometimes, you know, this is what we want to do. We want to go in and fix it, but it's the worst thing we could do. We need to listen, understand, just be with her, walk with her, and support her in making the safest decision. She will get to it with our support, with the questions we ask her. Remember, we said, don't make assumptions, hold some hypotheses, ask questions, because it helps her to find answers and helps her to ask more questions as well. And that is a better way of getting her to find the answer for herself and her children. Otherwise, she may feel she's not good enough and that you also believe that you need to come in and do it for her. So all our knowledge and skills are going to be meaningless and futile unless we have a relationship and connection with these women that come into our counselling space. And it's our responsibility to model that respectful relationship. So hence, don't jump in and fix things. We do it out of good intentions, perhaps, but it certainly doesn't do much good for her own self-esteem. And that, you know, she's still, that shame is not far away. And we need to name the power imbalance, not what she experiences with other services, but she may also experience that at different times coming into our space. And, you know, being open to hearing about that when she has a bad response with, you know, someone who's answering our phones for us. That's happened here as well. So keep noticing her attempts to resist the abuse. That ongoing risk assessment and safety planning needs to be done with her. Acknowledge and honour her resistance and strengths, and keep doing that review with her just to check in, is this partnership between you and the woman still meaningful? Is it still helpful? It might not be if she's going through a lot of stuff, a lot of legal stuff that she's got to attend to, and she hasn't got time to come to appointments. She's busy doing legal stuff, and she's better off talking to solicitors and, you know, or even, you know, women's legal service. There may be other things she's got to get on with, and we let her know that we are here when she's got that time and space, or she can call us, that, you know, we can make time just for a brief session, trying to fit in as best we can. And that will depend on, you know, our work practices and, you know, where we work and how we work.
Okay, so we use a range of interventions in our own practice. And so we all would develop knowledge, skills and experience in a range of theoretical frameworks and interventions, and we're sure you have your own. And I'm just going to go quickly through some of the ones that we use for counselling and group work. So Barbara will talk more about the Safe and Together model. David Mandel is the founder. Response-based practice, Alan Wade, and we've covered a lot of these references in our reference list that you'll be provided with. Internal family systems, Schwartz, he's the founder. Neurobiological models that we've mentioned, Janina Fisher, John Briere, again, there are references there. Narrative therapy, again, the externalizing of the problem is so important when women, one of the tactics of his abuse is brainwashing. Parenting in the context of domestic violence, some of the group work we use here in our service, Circle of Security, and some of the other parent-focused, and we run it with a trauma lens. Because Circle of Security is out there for a lot of women around parenting. Psychoeducation is huge, and we have some tools around, as we said before, a lot of women don't even know that they're experiencing domestic violence, and we have our trauma resources and tools that we'll run through at the end. Group work, it's really important that it's not in isolation, because a lot of women have trauma histories. And it should be an adjunct to counselling to complement and strengthen the counselling outcomes. So it's really important that women are safe to go into a group and are stable. Some people set up groups and there's women who can be triggered, and group work is it's negative. It has a negative impact. Group work is really positive when women are able to go into a group with other women with shared experiences. That's so powerful. It's different from us as the therapist or the counsellor. It's good for them to have that, but it becomes strengthened for them in the group. It also addresses isolation and encourages those connections, which is healing, because isolation is trauma, and that's the abuse tactic he uses to isolate. As we said, safety and stabilisation, and it's grief and mourning that women can share and talk about, because it's so hard, because it's a loss, but it's a loss to them. They would have had hopes and dreams for a different life with a partner, not to be a single mum, and it's really important that loss, it's huge and validated, because a lot of women get the attitude, well, you've left him, what are you upset about? Why aren't you just getting on with things? Okay, so trauma and domestic violence and mental health. It's really important to stay in the present with women and to engage with them, as we've said before, to maintain an awareness and understanding of the possible link that we've talked about with mental health issues. Always have a domestic violence informed lens and see mental health issues within that domestic violence context. Believe what she's saying, even if she's acutely unwell, without judgment, blame or attributing pathology. We're again normalising symptoms in the context of DV. We look at using the trauma-informed principles of safety, trustworthiness, choice, collaboration and empowerment. It's really important to keep that focus of the question, this question is so important, what has happened to you, not what is wrong with you. Her story is what matters here, and her story about domestic violence and his tactics. Acknowledge her coping mechanisms, like I said, and not to see them as pathologies, but as survival strategies. For example, eating disorders, self-medicating, self-harm and alcohol. Okay, just a few slides on resistance. We won't go into too much details, but just to be aware that when women experience abuse, they work out ways to do things to keep themselves and their children safe, so internally and externally. Alan Wade says, when there is a history of violence and oppression, there runs a parallel for women to be creative and have determined resistance. And it's an inherent ability to respond effectively to the difficulties that women face. And they resist in ways that are not obvious to the perpetrator. As Jenny did, she was able to continue to have contact with her friends and tagging it on to going out shopping, so he didn't have to know. So at other times, women may judge it safe to be overtly oppositional to the violence, but usually it's covert. And it's a way, resistance is a way that women can experience a sense of accomplishment, keep their dignity and be safe. Okay, so it's really important for us to keep asking women about what they do to resist the abuse, and that's their strengths and their courage and their dignity. It's easy to judge and overlook what a woman is already doing to resist abuse. That often is invisible to others. Ask about the particular experience of violence, abuse and entrapment, and have a think about what women do and how they resist abuse.
I guess thinking about, it's like being in a concentration camp. There's not much you can do, but even there, if we read about histories of people in concentration camps, there is always resistance. So women are always resisting. And it's just, important that we notice.
Okay, yeah, and this is a quote: resistance is ubiquitous. Whenever individuals are subjected to violence, they resist. Alongside each history of violence, there's a parallel history of resistance. Victims of violence face the threat of further violence, from mild censure to extreme brutality, for any open defiance. Consequently, open defiance is the least common of resistance. And as we said, strategies of resistance uphold women's dignity, reflects her courage and strengths, and how she is keeping herself and her children safe. Just an example where the perpetrator, his actions are to isolate and control the victim. And examples of her resistance might be attempts to continue friendships via the phone, or as Jenny did when she goes out shopping, finding ways to get out of the house and escape control, and holding her head up high while she privately hates the perpetrator or has a script going through her head as he's saying abusive things to her.
Okay, now Safe and Together model, I really recommend this to everyone if you're not familiar with it already. It was a model developed, as Vena said, by David Mandel, and it was in the United States for Child Protection Services, who were looking at better ways of protecting children, particularly in the context of domestic violence. It is a child-centered family violence model, which is behaviour-based. And by that I mean it concentrates on what his behaviours are, which is why, I guess, as a service, we've even sort of, as I said, we keep reviewing our referral form, and we reviewed it a few years back to make sure that that's what we ask referrers about. What are his behaviours and how are they impacting on the family? Safe and Together model, if you Google it, you will go into their website and find a whole lot of amazing resources that will help you map his behaviours and look at linking that to the impacts, and also being able to honour and see what she is doing. So you're also looking at how she is operating given his pattern of behaviours. It's a model. There is, each year they come here to Melbourne for a conference, haven't done so in the last couple of years due to COVID, but they do. There's a virtual conference in May. Again, we've got the link for that, and I do encourage you to take a look at that. The central thing that the model does is that it looks at services that are DV informed competent and DV informed incompetent, and what they found, and what it's not just mental health and addiction services, a whole range of services who fail to integrate coercive control into their assessments. So DV survivors are harmed by the lack of education and training. I've got of health professionals, but it's also of people working in other systems. The police also, they lack a lot of training and education. There are a few good police officers who really do a great job, but a lot of them just don't know what they're doing, and they just follow procedure. And you've got to use your thinking brain in this sort of work. Yes, so I've said they map the perpetrator's pattern of behaviours and the impacts on the family, and how the perpetrator actually interferes with the mother's efforts to promote child safety and well-being. And they have the collaborative parenting lens, which means that he is accountable for his parenting. we expect him to be a parent. There's none of this, you know, she's the parent and he, you know, he does a good job of bringing in the money maybe. What is he doing? How does he choose to be a parent? And so child protection services who work with perpetrators will form a contract with him and say, look, we've talked to your partner, we've talked to your children, and this is what they say about what it's like living with you, and this is why they feel unsafe, and this is what we would expect of you. Are you prepared to sign this contract to, you know, address these behaviours? So it keeps him accountable. The documentation of perpetrator behaviours is really important, and it's also language that can unify services. So if you think about, you know, women going to family law proceedings, if we can clearly document perpetrator behaviours and link them directly to the impacts on the children, that the court will understand that, and its language. If we talk about a lot of our models like narrative therapy and her story, and a lot of services out there don't have the same language as we do. So it's good to see if we can use language that other services will understand, and that we're very clear about what we do and what our expertise is. The intervention is with perpetrator to reduce his risk and harm to the children. That if you're a child protection service or a service that works with perpetrators, but even if you're not, it's important to keep the perpetrator in mind, as we've said earlier, you know, because we've got to understand what he's likely to do. And perpetrators are different. Some will want to change, and others are really not interested. So the model is aimed at keeping children safe and together with a non-offending parent, which is usually the mother. And they partner with the mother as the default position. Partnership is always part of this model. You can't do it unless you are partnering with her. It's a strengths-based approach, and so it asks, what are we doing to partner with her to support and strengthen her ability to act in ways that are going to support child and family functioning. It's not about, like child protection services used to do, and some unfortunately still do. In Australia, different states do it. Some do it better than others. Some have really taken the model on board and some haven't. And it's important that we get away from the blaming and, you know, she hasn't engaged, and not looking at, well, what's preventing her from engaging here? What are we doing that's getting in the way with partnering? The other thing the model does is really considers the impacts of structural sexism, racism, colonisation, how marginalised groups who are already oppressed, if women belong to these groups, you know, what the impact of that is. That adds the extra layer. They, as I said, on the website, they have really great diagrams, they have great resources. Please go to them. And this is just one, Multiple Pathways to Harm, which looks at all the different ways that his behaviour is impacting, whether it's impacting on her, the way she parents, gets in the way of her parenting, whether it's direct trauma to the children, whether it's about all those things, you know, all those losses, and obviously the direct harms that, you know, children present with certain behaviours at school or childcare. So children and domestic violence, we've always found, and this is why we have groups for mums around their children, is that the strong relationship between mums and their children will support their healthy emotional, psychological brain development. We maintain a safety lens at all times and are mindful that abuse escalates when the mother-child relationship strengthens. So he will certainly increase his tactics, escalate. So supporting mothers to support their children and making visible all those practices that they do, things that we don't notice, whereas if he does it, oh, isn't he wonderful? He's brought the kids to school. Mums do this all the time, and I guess this is part of the value of Safe and Together model and models that work in a similar way, that we have the same expectations of him that we've had of women for years. So not blaming her and seeing the perpetrator as this one that's only the sole responsible one for the perpetration of violence. And whatever problems people see the children have, the problem is really not located within the child. It's an impact from his behaviours. The development of children is impacted and disrupted. And you'll see it in all sorts of ways, either in the classroom, out shopping. Something will trigger that child and they will act out, or they will just retreat into themselves and not cause any problems in the classroom because they just don't want to be noticed. It's too dangerous. So we've got to be careful when children present that we don't, so, you know, if we're working mainly with children, that we don't diagnose their behaviour and view it outside the context of domestic violence. I mean, domestic violence is so prevalent. You can bet that whatever, you know, a lot of our the clients, our speech therapists downstairs, they're children from domestic violence. So being mindful that children are presenting with the impacts of domestic violence. And the relationship between mother and children, unfortunately, is one of the greatest casualties of domestic violence. He will continue working to disrupt that relationship. And if I think of all my cases at the moment, even though they've been separated for at least a year, there are signs of how his behaviour has destroyed, or if not destroyed totally, but disrupted the relationship with at least one of the children. And that's very hard to watch.
With the mum.
Yeah, yeah. And services are not terribly helpful. Even, you know, there may be legislation there saying that there's a court order that he's not to have contact. He finds ways.
With the father.
Yeah, not to have contact
Yep.
with dad. Sorry. Thanks, Venus. And as Venus mentioned earlier, maternal alienation, that's the deliberate use of tactics that are going to undermine that relationship. So if we're looking at children's recovery, it's linked to strengthening communication between mothers and their children and to the mother's recovery. Children really do best with their mums, and they recover best. They don't always connect to a counsellor, no matter how nice she is. It takes a long time for a child, particularly a child who's experienced so much trauma, to feel safe with a stranger. And I guess, you know, there's a service that because women very often ask us, oh, where can I take my child? And there is a very good service. Again, we've provided the link for that, and that's Kids Express. They work with expressive arts, art therapy, drama therapy, music therapy, with children who have experienced trauma, and that is, you know, a good connecting way of working with children. But mum is always, you know, if we support mum, then we're doing a lot for the kids.
Yeah, just moving along, there's a diagram here, and you'll have it in your presentation. And there's a report, again, if you'd like to read that. But this diagram reflects the women's journey away from family violence. And we've talked before that it's so important to have supports because that will increase their journey away from abuse. And that's around depending on services such as social supports, housing, finance, and so forth, and that if services don't work together and they work in silos, or if they don't work quickly in partnership with a woman and other services, that it can be an obstacle and women don't end up leaving. Okay, and we've talked a little bit about other systems, and this is a really great model by Marianne Hester. It's a 3-planet model. because there's contradictions within systems, and this can be a huge obstacle to women being safe and their children being safe. So we have Planet A, which is around domestic violence, and it's the criminal and the civil law system, and where domestic violence is considered gendered, that it's male perpetrators and it's considered crime, and sometimes and this is where AVOs are taken out by police, and for some men this is very powerful, but we know there is a proportion where it's not. Then you have Planet B, which is the mother, where it's blaming of the mum, it's the child protection planet, and that is looking at the welfare approach, where women are seen, and again it's gendered on the woman here, that she's not doing enough to protect her children if she stays with him. Takes no consideration of his tactics of abuse, of the years of brainwashing, maternal alienation, and the fact that she could be killed if she goes. And then again we have another Planet C, which is the family law planet, where again there's mediation, negotiations, and unfortunately it's neutral and ungendered, and it doesn't really take into consideration him being an abusive father or a severe abuser, and it's about parental responsibility, that he's a good enough father. And so we see over and over, and this is where we look at vicarious trauma, and we have to have these conversations, because family law unfortunately does not support women and children to be safe. We've seen, and we're sure you have as well, so many women go through family law and the perpetrator gets access to the children regularly. No consideration. Often perpetrators will get barristers, and they'll get their way, and they often get access to very, very young children, and they continue to abuse the children and the mum. And it doesn't matter how disinterested they are in their children, they will grab onto that opportunity. Okay, so again, we're looking at services that they need to work together to support women and children leaving violence in a timely and safe manner. Again, we've talked about protection and legislation, police processes and training. Unfortunately, AVOs don't keep women safe. Police, unfortunately, don't. As Ava mentioned, we have great police officers, but we don't, with good approaches, but it's not consistent. Visa issues, family law, financial and accommodation issues, Centrelink and housing are not always timely. There is a program, Start Safely, through Housing New South Wales, which can support women to get accommodation subsidised, and it's a rental program. Again, with that, you probably have heard of safety action meetings, which came out of many fatalities in relation to women and children dying. And the safety action meetings happen across New South Wales, where different government and non-government services come together for women who are considered high risk. And the aim of that is to make services accountable to working with women and facilitating their safety and the safety of their children in a timely manner. And it's been a great initiative. You can actually look that up, safety action meetings, you may already know. Again, it's important to be non-judgmental and continue that support and work with other services. Advocacy is huge for us in our roles, to continue to support women and advocate with them, to empower them by facilitating their access to services and information and support so they can navigate complex systems. Important to network with who's in your area and work collaboratively by finding time to consult, liaise, talk with services about how to work together to overcome barriers, and update our knowledge, services and resources available.
And if you can have a connection with a solicitor that works in your area, who's community centre solicitor, of course. New South Wales Women's Legal Service is a great resource, and again we've got a link for that, and we encourage you to go into their website and go onto the Ask Lois platform. That's something else that's there, but it just helps sustain the work, and it is helpful when women can get some good legal advice. Okay, so the resources and training that we're recommending, of course, it's there's much more, but this is what speaks most to us at the moment. Safe and Together model, please go in and have a look at that link. It just takes you to the virtual conference and you can find out about it. You can also then find out, some of those other resources that's on their website. For the neurobiology of trauma, some names that you might be aware of, but they're names that, we've used their work and in our practice over the years. Janina Fisher and Jean Briere, this is a link to a webinar program that's running at the moment. And John Briere and Janina Fisher, I think there's Peter Levine, unfortunately, that has happened, but John Briere and Janina Fisher, that's still coming up. So if you want to go in and have a look at that, that's also very valuable. There's a link to Healing with Fragmented Selves of Trauma Survivors, a book by Janina Fisher. Really recommend that. There's chapter 7, which is on working with suicide, which is particularly important, working with when we're talking about women's internal safety. The response-based practice, a link there to Alan Wade and Linda Coates. Again, we're looking at the internal safety. Kids Express, which we mentioned earlier, please go into that and find out about the sort of work that they do. Insight Exchange, now when we're talking about social action, this is worthwhile you getting on their mailing list. They, as it says, they're looking at possibilities. How can we make things better for women? How can we make that external world safer for women and more responsive for women so that, they get better outcomes? Whole list of references, won't go through all of these, but not at all exhaustive, but some of the people we've referred to as we've gone through, some we haven't mentioned at all. Humphreys, when we were developing our groups for mums and children, we used that reference. It was a study that was done in the UK when Kathy Humphreys was over there many years ago, as you can tell by the reference, but they created an activity workbook by working with women and their children in refuges.
And just on that, our service developed a group, Connecting Conversation, which was facilitated by our team, mainly Marion Town and Sarah Stolino at the time. And it was around strengthening the connection and the communication between mothers and their children. And another group I didn't get to mention was working with mums around supporting them to understand the behaviour of their children to understand the impact of the perpetrators' abuse tactics on their children when they came back from access visits, so that they wouldn't, they'd be able to respond within that context of domestic violence rather than to take it personally if the children were defiant to them.
And just another few more references in here. The Kathy Richardson and Vicky Reynolds was the one that I was referring to earlier when we were talking about burnout prevention. Holding ourselves together with an ethic of social justice, and just remaining alive in the work for us as workers. And the reports right down the bottom, they are oldies but goodies, looking at women's pathways moving away from violence. One is from Victoria and the other one from Tasmania. They're worth a look at when you have time. And here we won't go through these, but these are the contacts we've mentioned. Some we haven't, but they're obvious because we're not a crisis service, so we need to, make sure that women, when we're not around, for them to pick up the phone and us, to have a few words, that they will have someone that they can talk to. But also there's, all the others that we've mentioned, like the Women's Service. Immigration and Rights Centre, we haven't mentioned them, but you're probably familiar, particularly for cold women who don't know about their rights, who have been told all sorts of amazing things by their perpetrator husbands and partners. And then for men who want to stop using violence, there's a list of those that are not just doing anger management, but are actually holding them to account and getting them to take responsibility. And these are where I'm just aware of time, so we were going to go through these, but there's the Dulles. These are also came out.
Can I just mention here?
Oh yes, yeah.
One of the important ways that we sometimes use these two wheels, and this won't take long, often women feel very ashamed that they have chosen a perpetrator and they can't understand like what's wrong with them. And one of the useful ways to actually use this tool is we often tell women, it's the equality wheel, sorry, it's hard to see, but what we try and explain is the equality wheel is what they see. They see a man who's really respectful. That's the grooming, that's the mask he puts on. And we say that what actually happens as time goes on, the mask goes, and what they end up with is, this is the power control rule, they end up with an abuser. So they don't actually choose a perpetrator, they choose a man who has a mask on. Anyway, that's all we want to say, and you'll get a package. Thank you, everyone.
Yeah, this is difference between, often people talk about conflicts and arguments, and there's a real difference between that and domestic violence. Again, a Janina Fisher one, please look at this. We're going to wave some resources at you, but we've run out of time. Please, follow these up yourselves. It's another tool we use. Okay. Often, as we said, women are stuck there, they're entrapped, they're not going to get away probably until they're old age pensioners or until he dies. And all we can do is actually be there for them. And I found this quote from, it's the opening in the diary of Anne Frank, where she has received this diary for her birthday, and she wanted to be a journalist. And I think most of us know about the diary, but it's the story of a 13-year-old girl who just writes the story of her family and 4 other people who have hidden behind a bookcase in Amsterdam, and then are eventually found. And the only survivor is her father, Otto, who then published her diary. And so she, this has remained for us. And how she opens it is, she says, "I hope I will be able to confide everything to you, as I have never been able to confide in anyone. And I hope you will be a great source of comfort and support." Unfortunately, that's sometimes all we can offer women, but it is so important. It's something we should offer all women, and for the lucky ones, we can offer more than that. But for some who will be entrapped, that's all we can do. We can just be that source of comfort. It's similar to Anne Frank being, using that diary as a way of surviving and getting through and giving them a voice. And that's what the diary did for Anne Frank, is gave her a voice. So we don't all go away and cry. Briere, who, if you go into one of those links, you can still, join that conference and listen to him talk. He talks a lot about hope and how holding the hope is a powerful antidote against the helplessness and despair that's associated with many traumas and losses. The installation of hope is a powerful therapeutic action. And that is such an important part of the work we do. So we're done. Sorry, Lauren, we haven't left. We were going to leave you more time at the end, but we're just...
That's okay. That's okay. Thank you so much to both of you. That was incredible. I've been in DV for over a decade and I still learnt a number of things this evening. So thank you so much for your time. Thank you everyone for joining us. There was a question from a participant that we don't have time to answer, which is about recording domestic and family violence, particularly in the context of being subpoenaed and, what that might look like when it's used against them. I will send out some information about that, and perhaps Ara and Venus, if you want to contribute to that. Also a note on that, we do have a training coming up in June. It's actually targeted at GPs, but if you are a psychologist or counsellor and you wish to join, you can. Just acknowledging that it's targeted at GPs, and it will look specifically around recording domestic and family violence, and the implications of that if they get subpoenaed. But yeah, thank you so much to everyone for joining us. If you do have any questions, please feel free to email me. I've put my email in the chat. I've also put my the Domestic and Family Violence Assist Program number, which comes directly to me at the moment. So please feel free to contact me. If you have any questions for Ava and Venus, I can pass anything on, and you will receive a package, hopefully in the coming days, with all of the articles, resources, a list of services in each area that we cover at Central and Eastern Sydney PHN. And yes, I think we can leave it there then. Thank you everyone very much. We really, really appreciate everything. And big thanks to Bertha and the CPD team for helping put this together.
And you, Lauren. Thank you very much.
Pleasure. All right. Have a lovely evening, everyone.
Good evening to everyone. Bye.
Bye.